Welcome to the Michigan Trauma Quality Improvement Program. In this section of orientation, we will review injury diagnoses information. ICD-10 injury diagnoses are diagnoses related to all identified injuries. Injury codes are further broken down under the Patient Inclusion Criteria section in the Introduction chapter of the Data Dictionary. Additional ICD-10 codes pertaining to non-injury conditions such as CVA, MI, comorbidities, etc. may be included in this element if the center chooses, but are not required reporting. AIS, or Abbreviated Injury Scale Severity Codes, reflect the type and severity of the patient's injuries. These codes range from a post-dot of 1, which is a minor injury, to 6, which represents a virtually non-survivable injury. There is also a 9 post-dot score for injuries that are impossible to assign an actual injury severity to. A patient's ISS is their calculated injury severity score, which helps define how severe their injuries are. Each injury is assigned a score depending on its severity. The patient's total ISS score is the sum of the square of the highest AIS and each of the 3 most severely injured body regions, and can range from 0 to 75. There are 6 body regions that injuries can be assigned to. Any injury assigned an AIS of 6, which is considered a non-survivable injury, is automatically assigned an ISS of 75. NISS stands for a patient's calculated new injury severity score. Unlike the ISS, the NISS is taken from the square of the 3 highest AIS scores, regardless of the body regions they fall into. Max Head Neck AIS refers to the maximum severity value of AIS for all injuries assigned to the head or neck body region. This region includes injuries to the brain, skull, cervical spine, and cervical spinal cord. There are also injuries such as asphyxia or suffocation that are assigned to this region. Max Face AIS refers to the maximum severity value of AIS for all injuries assigned to the face body region. This region includes injuries to the mouth, ears, nose, and facial bones. Max Chest AIS refers to the maximum severity value of AIS for all injuries assigned to the chest body region. Chest injuries include all injuries to the internal thoracic organs, named thoracic vessels, diaphragm, rib cage, sternum, and thoracic spine and thoracic spinal cord. Max Abdominal AIS refers to the maximum severity value of AIS for all injuries assigned to the abdominal or pelvic contents body region. Abdominal injuries include all injuries to internal abdominal or pelvic organs, named abdominal vessels, lumbar spine, and lumbar spinal cord injuries. Max Extremity or Pelvic Girdle AIS refers to the maximum severity value of AIS for all injuries assigned to the upper and lower extremities as well as the pelvis. These injuries include injuries such as fractures, dislocations, sprains, crush injuries, and amputations of the upper and lower extremities and pelvis. This area also includes the clavicles, scapulas, and sacrum. Named vessels and nerve injuries are also included. Max External AIS refers to the maximum severity value of AIS for all injuries assigned to the external region. External injuries include lacerations, contusions, abrasions, and burns. It also includes penetrating injuries if there are no underlying injuries to bone or organs. Hypothermia and frostbite are also coded to this area. Thank you for watching.